tuning in today, everyone. I just want to let you know my book is out and available on Amazon and Barnes& Noble. The name is Parents, Our Greatest Teachers. And now, back to our
everyone, this is your host, Alex Belgood, and this is Leap of Health. And today we have Tanya Paynter. She graduated from the University of Washington with a Bachelor degree in Cellular and Molecular Biology and a minor in Inorganic Chemistry before attending medical school at Bastyr University. And she's a she got a Naturopathic Medical Degree. And all this sounds super, super fancy for all of our listeners, but it's so cool. Someone has to hit the books, and that was you.
Yes, that's right.
And we're going to be talking about migraines today. But before that, tell us a little bit about yourself and how you got yourself into all this schooling and got to be a neuropathic doctor.
Naturopathic doctor. Yeah, it all started back in fourth grade. I took my first health class. I remember sitting there in my classroom, looking at all these different systems in the body and just being so amazed. I'm like, I want to be a doctor when I grow up. So fast forward quite a few years, and I discovered this type of medicine called naturopathic medicine. And it was all about using herbs and nutrients and food and movement and all these other things to kind of really get at the core problems that somebody might be struggling with. And that to me was really what medicine was about, as opposed to here's a prescription, I hope you feel better kind of thing. And so I kind of shifted gears from a conventional medicine education and went to Bastyr University, which is one of the accredited naturopathic medical schools. And I absolutely love it. It's amazing. And it's everything that I hoped it would be, helping my patients actually figure out what's going on in their body, really understanding the biochemistry behind what's happening, and being able to look at those cellular mechanisms, which, as you mentioned, for my undergrad, that's where I loved focusing, was in the biochemical and cellular biology. So it's kind of fulfilled that desire as well. So I get to be the big science geek and really learn about the body and how it works together.
No, that's amazing. I think that's super important to really know how the body works, to have a different understanding on how to help it. I feel like I don't know if you know much about Oriental medicine, but I feel like that's what they were going for, to really understanding what's happening with the body and like how we react to different things, and go to the root of the problem, as opposed to just here is this medicine, it's gonna make your cough better or something, but it's not really fixing what it is. So I really love that you actually know all the science behind that, because I think when it comes to explaining things, I think it's important to go with someone that actually knows what they're talking about and know how the body functions, as opposed to just be like, oh, just do this, take this herb or whatever. So awesome that you know all this. And we're going to be talking about migraines. I know it's if you ever had a migraine, we know that it hurts a lot, and that sometimes we don't know what to do with it. What's some of the science behind a migraine?
Yeah, I mean, there's quite a few different types. Generally, to be diagnosed with migraine, you have migraine days that are not, headaches essentially, that are not treated by over-the-counter medicines. Things that you try at home don't work. Chronic migraine is diagnosed when you have more than 10 of these a month for longer than 3 months. And they're usually accompanied by other symptoms. So in order to be diagnosed as migraine, you not only have the head pain, which is most common, but there's also other types. But you also have symptoms of, light sensitivity, nausea and vomiting, dizziness can come with it. So auras, where your vision gets all weird. So there are other neurologic symptoms that come along with a diagnosis of migraine. And then there's also kind of and it's usually, one-sided. And but there are other types of migraine as well. You can have, vertigo, where it's just bouts of dizziness called vestibular migraines. You can have things that are similar to migraine, but not the same, like cluster headaches or, hemiplegics, things like that. So, so any of those kind of fall in that migraine umbrella, although they're all slightly different.
Okay. So it's safe to say that more than a day of headache, you might be having a migraine.
Yeah. So a lot of times migraines will be from 24 to 72 hours. Sometimes they can be longer than that. Sometimes they can be shorter, but we generally see it, 12 to 24 hours is most typical.
What are some of the things that you recommend for the patients that you treat? I know there's out there a bunch of medicine that people might just be like, oh, I have a migraine. They have no idea why they have it, but they know they have a migraine because maybe they went on Google and they're like, well, I check out all these boxes. This is a migraine. I'm just gonna go to the pharmacy and get me some migraine medicine. So, and but they don't know why they having this migraine. What are some of the things that you do first before telling them this is what you need to do? Because I know, as we all know, just going to the pharmacy sometimes is not the best bet, because you're not going to the root, as we were saying. You're just kind of like calming it down for like a bit.
Yeah. Well, I mean, anyone who's experienced a migraine, when you're in a migraine, you don't care, right? Any
Right.
medication you can take to get you out of it is going to be, good to go. But it's more the longer term of, all right, I don't want to be stuck on these triptans, all 10, 12 times a month, if you can even get that many. So, obviously the first step is to understand that this is an issue with migraine. And unfortunately, a lot of people are actually underdiagnosed. There's already, I think the most recent statistic is 38 million people in the US alone are diagnosed with migraine, and it is an underdiagnosed issue. So there are more than that going on. They just haven't really sought the help of their doctor. But if you're experiencing symptoms along with your severe headaches, that you're, nausea or vomiting or light sensitivity, sound sensitivity, things like that, your skin is super sensitive, you have scalp pain, you have eye pain, you get dizziness, any of those symptoms along with a headache is something more than just a headache. So the first step is go into your doctor and talk to him about it all. The most commonly prescribed medication for a migraine is going to be starting with a triptan in most cases. And then, but you can only take usually the diagnose or the prescription is only for 9 a month, right? If you need more than 9 a month, there's a bigger issue at play. And then you need to look at preventatives and some other stuff as well, because then you can get stuck in that medication rebound cycle where you take the medication and as it wears off, you get the migraine back. And then you take another medication. And then when it wears off, the migraine comes back. And then you're just stuck in this horrendous cycle of, I need more meds. The meds are making this worse, but the worsening needs more, right? So those are the types of situations we want to try to avoid. So there is some over-the-counter stuff, Excedrin migraine and some other things that could potentially help. But again, you're right, we're not getting to the root of what's causing it. Sometimes it can be dietary, sometimes it can be stress related, sometimes it can be hormones, sometimes it can be sleep. Sometimes, usually the people that I end up seeing have tried all of the different medications. They have, tried a bunch of different types of therapies. They've tried diet, they've tried stress reduction, they've tried it all and nothing is working. And that's because by the time I see them, things have been going on for 10 or 20 years and their body is just really out of balance. And so then we need to work on multiple different areas to get them back where they need to be to feel healthy. So it can be quite a process.
Yeah, for sure. I honestly kind of like new to migraines. I've never, thank God, never experienced a migraine, but I do have two of my cousins. They're like about my age and they always have migraines.
Yeah.
And it's kind of like what you're saying. If I've never experienced a migraine, I can't really know exactly. To me, it's just like a headache. Right. But as you're saying, it's like way more than that. And it has a lot of symptoms like the light, the noise, and, vertigo and all these things. So for those patients that just starting to have migraines, and you mentioned diet, what's some of the diet that helps some of those people that are like trying to figure it out what it is, and they don't even know diet is a factor in this?
Yeah. Yeah, I mean, there's actually quite a few different suggestions. So it can start to get really confusing. Generally speaking, if you're brand new, you've just been diagnosed, you're just kind of trying to figure out what you should be doing for yourself to make you feel better. Generally, the best diet to follow is just an anti-inflammatory diet. So something like the Whole30 is a good place to start. What we're looking at doing is trying to cut out sugars, cut out processed food, cut out dyes and chemicals. Those are by far the biggest triggers. MSG, another really big one.
Wow.
And then once you've kind of got that under your belt, because that in itself can be a big change in how you're eating, because all that packaged food needs to go out the window. We need to start making things from scratch. And who has the energy for that, especially if you've got migraines going on? So so it can be kind of a double-edged sword there. So it can take a little while to figure that part out. But then as you kind of progress through, depending, I mean, for some people that alone can be a night and day difference. And that's fantastic. But then there are the ones that, histamine is a problem. So histamine is a neurotransmitter that it excites us. It kind of gives us energy. It gets us moving, but it's also released by the immune system to fight viruses and infections. So it's a pro-inflammatory neurotransmitter / biochemical that helps us to fight off infections. And so that's really helpful when it's done the way that God intended our bodies to work. But when we have seasonal allergies, or if our body can't clear histamine well, or if we have stuff going on in our gut that makes us have too much histamine, that can actually be a migraine trigger in and of itself. And so then we look at doing things like a low histamine diet and some other things. But then you can also find, well, a low tyramine diet is good for migraines. And in certain cases it is. So this is where it starts to get really confusing. And one of the things that's really important for people to know, not the simple migraines, and what I mean by a simple migraine is if you need a triptan once or twice a month and that takes care of it and you're good to go, those are pretty straightforward migraines. When I'm talking about more complex migraines is when you have 15, 20 a month and your triptans maybe work sometimes, maybe don't. Sometimes you take an Advil and that works, but then other times nothing will touch it at all unless you sleep for 72 hours, right? So that's really, it can be very convoluted in understanding, and a simple diet doesn't exist. It's not a matter of histamine or tyramine or, Whole30 or any of those. It's finding specifically what migraine triggers are happening for that person. And so in my clientele, the people that have been chronic for decades and nothing is working, they usually have 3 or 4 types of migraines going on. So there might be a hormonal component, and then there might be a histamine component, and then there might be a dietary component. And so until we can figure out all the different pieces that are triggering their different migraines, a simple diet change isn't going to really work for them. So then they're like, well, what's even the point? And they go back to eating, the diet that's really not doing anybody any good, because they don't see a difference one way or the other. And I get that. I was there at one point myself. I used to have daily headaches, and they would flare into migraines fairly frequently. And so I totally get where you're coming from. You don't have the energy or the wherewithal to actually make food from scratch. So if you don't see any improvement, you're not going to keep eating that way, And so it's more a matter of, for those more complicated situations, to really try to figure out what are these underlying things that are contributing these imbalances. And that's where I come into the biochemistry part of the migraines and really start to understand some of the different neurotransmitters and the hormones that are going on, some of the immune reactions that can be happening. What is gut health looking like? Because there's a huge link between gut health and migraine. And, putting all of the pieces of that puzzle for an individual person together, because it's not just a one size fits all. It's not, oh, you have allergies, here, take an antihistamine. It's, oh, you have migraine. Well, let's take a look at all the different things that it could be and what is it for you, right?
And you mentioned hormones. Nobody really thinks about hormones in a migraine. What's the connection of those two?
Yeah. So a lot of times people will be put on birth control to help control migraine. That is one of the preventative options. And that can work amazingly well for some people. And in other people, it doesn't do anything, or in some cases, it can actually make it worse. And one of the things that we do know about migraine is that fluctuations in hormones can trigger it, usually associated with drops in estrogen, although we do see low testosterone and low progesterone contributing to an overall migraine picture as well. So this is something that this can take a lot of investigating to kind of figure out what's going on from that standpoint. But if you have migraines, if they started around the time that you started your period, obviously we're talking about women here. And if you have, hormonal issues such as really heavy periods or a significant cramping, or maybe you've had a hysterectomy because you had really painful periods and you bled a lot, or you became anemic because you were bleeding so much, or you have cysts all the time, any of those hormonal problems can absolutely, even if you've had the hysterectomy, you still have the hormonal imbalance. It's never been addressed, right? You just had the uterus removed. So now you're just not seeing the heavy periods, but the hormone imbalance that was causing that in the first place still exists, right? And so then and I hear that confusion all the time, is like, well, I had a hysterectomy, so I'm not having a period. I don't have a cycle anymore. And while you don't have a period, you still have a cycle. We all have cycles unless our ovaries have also been removed, in which case then, we're not cycling anymore, but then we're looking at a whole different postmenopausal picture, right? That could be contributing from a low hormone standpoint. So there are a lot of hormonal pieces that come into it. And unfortunately, one of the things that I always like to mention when we're talking about hormones and migraines, that if somebody has blood work done and they're told that their hormones are normal, that's not playing a role. That's not often the case. Usually, if you're a female and you have chronic migraine, hormones are playing a role to some extent. They might come back normal on labs, but what a lot of doctors who don't specialize in migraine don't understand is that research shows that there are different normal lab ranges for somebody with migraine. And so we can't evaluate labs through just the general, these are the normal ranges. We have to look at it at a smaller range, and what research is correlating with increased frequency and intensity of migraines, which still can fall within that normal range. So unless it's somebody who's looking at those labs through the lens of somebody with a migraine and understands those different reference ranges, they're told all the time, oh, your labs are normal, everything looks fine. When in reality, when I look at them, I'm like, oh no, these are not okay. Like your thyroid is off, your iron is too low, your B vitamins are way too off, And so there's actually a lot of different research that just isn't widely known, because you can't, if you're just a general practitioner, you can't memorize all the different, normal ranges for the different things. So,
yeah, for sure. I think you touch on a really great point, especially when it comes to labs. We always have, for everyone that's listening, at least they have these normal, the normal labs have like a very wide range. What's normal? Everybody's different, and usually
that's exactly right.
And correct me if I'm wrong, but like most of these labs that are like within the normal range are not tested within the healthy like patients. They're usually taken, these averages or percentages are taken from like more of the not healthy patients. So that's why it's like really big. So when a healthy or more healthier person comes and does this lab test, they're like, oh, you're doing great.
Yeah, that's right. So it takes kind of the low end to the high end is about the 75 percentile of people, of healthy people. Anything outside of that is considered abnormal. But you're right. I mean, we are all individuals. And so there's normal and then there's optimal, especially given like a perfect example is thyroid. There's multiple studies that show that a thyroid, quote unquote, within normal range when it's on the lower end, is actually correlated with increased migraine intensity and frequency. So understanding that, we can't say, oh, your free T3 of 2.3, you're within normal range, you're looking good. Well, that actually is going to be a contributing factor, because anything below 2.5 has been associated with increased migraine frequency and intensity. So, you know, even something as simple as the thyroid labs aren't fully tested. If somebody's just testing a TSH, which is just your general screening test for thyroid, and that comes back normal, then they don't dig any further. But with somebody with migraine, I can't tell you how many times I've seen a normal TSH and their T3 is frankly low and their T4 is frankly low, because their thyroid is not being stimulated properly. And that's part of the problem. But until you dig a little bit further, you're never going to find that, because if your TSH is normal, then it's not standard of care to order a T3, T4. So there are different labs that we want to also be making sure that we're investigating for someone with chronic migraine to ensure that it's where it needs to be for that population.
Yeah, for sure. And I know you mentioned a little bit more on the cases for women. How about, and I know it's not that it's easier, but it's kind of is, because we go through a cycle every month, as you mentioned. And when it comes to like hormones, how is there a test that you do for the male patients? How do you know? Do they have a cycle too?
So they don't have a cycle, not in the way that we think of things, but they do have estrogen, testosterone, and progesterone, just like women do. And men can have estrogen and progesterone deficiency as well. But there's also a correlation with low testosterone and migraine. So in men. So we need to be looking at the quote unquote female hormones for men as well, because when they're estrogen, more commonly, it's the progesterone deficiency. Progesterone is an anti-inflammatory neurosteroid, which is basically a fancy way of saying it helps reduce inflammation in the brain, which is really important in a lot of different things, but especially in migraine. And so when we ignore progesterone levels in men with migraines, we're doing them a great disservice, because if they're low as well, and I've had many, many men that I've needed to put on progesterone for that reason. So progesterone prescriptions are not just for men, not just for women. Just like testosterone prescriptions are not just for men. Low testosterone in women can also contribute to a migraine picture too. So it's really important to advocate, if you're a man listening to this and you have migraines, to advocate that you have a full hormone panel, not just testosterone tested, because it affects you too.
Yeah, I think we forget that we all have both hormones.
Mm-hmm. Yep, it's just in different amounts based on your sex.
Exactly.
Yep.
So, but they're as important.
Yes.
So yeah, so definitely, I guess if you are having a migraine, it is important to have certain tests and go with an actual specialist that is specialized in migraine, because otherwise your lab tests are going to be worthless if you're just going to go with your regular family practice, and they might not know, because everything, as we just mentioned, everything might look normal, and that's, I think, a lot of the cases.
Yeah, well, and unfortunately, with the way that conventional medicine approaches health in general, is that everybody has their own little box that they're prescribing in, right? Mm-hmm. So the neurologist not really going to have a whole lot of idea of what to look for on the hormone end, but then the gynecologist isn't really going to know how to interpret hormones relating to migraines, because that's the neurologist deal, right? So then we have a bit of a what's the word I'm looking for? A separation, I guess, as opposed to being able to overlap. So that's where somebody trained in functional medicine or naturopathic medicine can really be helpful in understanding, because we look at the body as a whole unit as opposed to systems within that unit. And so the types of testing that we want to look at is more functional testing. So blood testing hormones is not as accurate. It's good for monitoring levels, but it's not great for really understanding how the body is able to access those hormones. And so that's what functional testing is looking at, how the cells are able to use the hormones that are there. Because when we're looking at blood levels of hormones, hormones have to attach to something to go through our blood because it's fat and our blood is water, and fats and waters don't mix, right? So the hormones have to attach to a molecule to transport it through the blood. And unless you're measuring those transport molecules as well, we're not really getting a full picture of what your hormones are actually doing, right? And so the blood testing for hormones isn't always the best way. It's a good way to see if you're frankly high or frankly low. That'll let us know, good, we need to do a little more digging here, but it's not really giving us the full picture of what's happening. So we want to look at urine testing or saliva testing. And again, that's more the realm of the ND or the functional medicine doctor, because conventional medicine really just does blood testing for the most part. There are some hormone, or there are some urine and urine labs. I don't actually know if anybody really does salivary testing for a whole lot. So that's really going to be looking at somebody who is more familiar with some of the functional testing to really get a good idea of what's going on with the hormones.
Yeah, for sure. And I, you touch on a great point, and I say all the time, I don't know if anyone's tired of me saying it, but we are a whole system. You cannot separate, the hormones from, I don't know,
The immune system.
the immune system.
From the gut.
Yes, exactly.
Mhm.
Like all the system work together. They're all friends and they all work together.
Yeah.
If one is down, they're all down.
Yeah.
They're not going to work properly. And I think that's just like a great way to just keep saying it. It's a whole system. You gotta go with someone that looks at the whole picture as opposed to just this little thing, this little issue, because otherwise you're not getting better. You're just like helping it, going by for more years to go worse, pretty much.
Yeah. I mean, conventional medicine is where I want to be if I need to be diagnosed with something, right? They know all of the different tests and the different illnesses, and they can figure out, what's going on and give you a diagnosis. And then once you've reached the diagnosis, and then they give you the recommendation, but then we can take that information and go over to the functional medicine side and say, hey, here's what they figured out. What do I do about it? Right. So, I mean, really, ideally, we have both types of medicine. Like, I want a specialist looking at all the possibilities and making sure that there's no cancerous issues, or there's no tumors going on, or there's, nothing really other disease process happening. And then when it turns into more of that chronic something imbalancey going on, then that's where our type of medicine shines, because then we're able to go back to, all right, we know all the scary stuff has been ruled out. It's not any of those things. So now let's take a look at what are some of the imbalances that could be contributing. So really, I see both of our sides of medicine just working together as for the best care for a patient.
Yeah, for sure. I think that's like the dream of, everyone, for just the, modern medicine and functional medicine, oriental medicine, kind of like just let's, that'll be my dream come true. Bring all my physicians and be like, please talk among yourselves.
Yes. Wouldn't it be great if we did all talk? I would love that too.
Oh my God, that would be like a dream come true. Unfortunately, because a matter of financial stuff, people like to break things apart and have modern medicine just give you some sort of diagnosis and give you something to just the symptoms. But then we're so lucky now in our times that we have a lot of functional practitioners, oriental medicine, Dr. Everlist, all of the other ones that are doing all these other things for us, which is great. I know you mentioned that you do some sort of therapy for migraines. So what are some of those that you recommend for some of your patients?
So therapies as far as physical modalities, or just how do I approach a migraine?
How do you approach the migraine?
How do I approach? Yeah. So we have kind of a, how would you say it? Well, initially with all of our clients, we do a full intake, right? So we're looking at our family history, the personal history, not just around migraine, but around hormones and sleep and stress and, family history of depression, anxiety. All of that gives us a really good understanding of some of the genetics that could be involved. If they've suffered from depression for a really long time, then we know certain neurotransmitters that are going to be involved. So we can really get a very good picture of them right up front of what's going on with their history. And then we have all of our clients run through a 12-week course that they're essentially working on all of the foundational things that research has figured out has a positive impact in brain health. So we're looking at things like optimizing sleep, working on stress awareness and management, working on diet, working on gut health, working on detoxification and antioxidant status. And so a lot of the things that we just know across the board is going to have a positive impact on everybody. And then we move more into the personalized part of our care for our patients. So as they're going through those first 12 weeks, we're asking them questions through the lessons and things. What are you observing? How does this resonate with you? What are you noticing about your migraines and what we've just talked about? And then they're feeding us that information, which is going to be different for every person. And so with their personal intake information that they gave us at the beginning, and then the information that they feed us through the first 12 weeks, we're able to build a pretty solid picture of what's going on for them as an individual and where they need that residual pinpointed treatment, right? So then we're looking at, all right, you've really got an issue with histamine. So now we need to work on how your body is processing that. Here's how we're doing that. We have protocols for things like that. They're working through that. They're working on dietary tweaks with our nutritionist to help optimize the diet for them. And then, all right, well, so great. We've taken care of the histamine, but now we've got some issues that are residual from gut damage caused by that. So here's some more targeted gut therapy. And then, all right, well, now we're seeing now your hormone or your migraines are going from, 20 days a month to around ovulation, around period. Now we're in just the hormonal piece. So now we move into that hormone and we target hormone treatment. And so we're taking these small steps and we're addressing one issue at a time as it becomes clear what's going on for them. And that's how we're able over 6 to 12 months to really get them lasting improvement. And for our clients, by the time they're done working with us, we're seeing an average of 90% reduction or better in our migraine, in their migraine frequency. So it's really a very impactful process, but it does take time because we're actually working on healing your body. So it's not, I take a triptan, I feel better. It's okay, I've been doing this diet for 3 months and now I'm starting to feel better, right? So it's a process. It is a process.
Yeah, and I like that you mentioned the time. That was my next question. How long do these patients stay with you? Because I feel like, and as I said, I've never had a migraine. I've just seen it from like my two cousins that they always have a migraine. And to me, it was like, but why? You look pretty good.
Yeah.
But, and I feel like people with migraines, they just want to like take something and that's it. It's gone. But you're mentioning it like 6 to 12 months. That's a long time. Why is it take too long? Is it because you're fixing little things within little things that need to get fixed? And how do you explain that to your patients? Because a lot of us, even with like any diet or anything like that, we're like, how long do I do this? Because I'm probably gonna last a week.
Yeah. Well, we do it very slowly, right? So we go with our clients and how quickly they can change. A lot of them have already done some of the basics, so we can kind of speed that timeline up. Some people, they see a significant increase or a decrease in their migraine within, 2 to 3 weeks. And some of them, it's a little bit longer. So it's completely based on the person and what's going on for them. But on average, I'd say what we tend to see first is when we start seeing these changes happening, it's not that their frequency decreases, it's that the intensity and the duration of their migraine episodes. starts to go down. So they might have the same number of migraine days for that first month, but they're starting to see their medications working better. They need their medication less, or they can just take care of it with, a cup of coffee and laying down for 30 minutes, right? So they can treat it much more successfully, even though the number hasn't gone down. So they're seeing changes, even though they haven't gone from 20 migraine days to 1 within 4 weeks. They're seeing, oh, this is way more manageable. Like I can actually live my life and not, be in bed for 24 hours after taking my triptan, right? So there's incremental stages. And so all of those changes that they're starting to see, they start seeing more energy, usually within the first 2 to 3 weeks. They're starting to see a better mood. They're sleeping better. All of those changes, like they know things are happening in their body. So it's propelling them forward and they know this is so worth it. And then, as we kind of get more targeted, the reason why it can take so long is because when we're dealing with hormones, when we're dealing with body systems, it doesn't change overnight. Our clients have been dealing with these migraines for usually 2+ decades. And so when you have 20 years of an illness, you're not going to get better in 2 months, right?
Mm-hmm.
It's going to take a while to replete the body with the nutrients that it needs, to make your body remember, oh yeah, I'm actually supposed to be putting cortisol out in the morning instead of just being flatlined, right? It's going to take a while for their body to remember how to do the things it's supposed to be doing because it's been so long since it's been doing them properly. And then, plus they're still struggling with the medications that they need to take, which are depleting their nutrients, right? And so we're still kind of battling against just living in society and the medication. We don't take our patients off medications. Like they wean themselves off based on the fact that they don't need them anymore. So they still have all the tools they started with, and they're still able to manage their migraines the way that they had before they started working with us. But then we just kind of progress through, and they start needing it less and less. And then they're able to start weaning off of their sleep aids and off of their antidepressants and all that kind of stuff because they no longer need it.
It's kind of like a good ripple effect.
It is. So it sounds like a long time, 12 months. It sounds like a really long time, but when you're seeing all of these positive changes, from week to week to week, it's really easy to stay motivated because what you're doing is actually having a positive impact on your body.
Yeah, for sure. And have you ever seen patients that they just go migraine free?
Yeah. I have quite a few of those examples. It's wonderful.
Wow, that's amazing. But I'm sure those are those cases that go through all these processes for a long time.
No, I mean, in some cases, if they didn't really realize the kind of diet that they needed, it's simply a matter of honing that in, which we do in that first month in most cases. And so within 4 weeks, they went from, let's see, the one person I'm thinking of, she went from 18 to 20 migraine days a month. Within those first 4 weeks, when we got her dialed in on her diet, the way that her body needed it, she was going months between it. There was another client that she started with us. She figured out some of these abnormal triggers, like the city water. She had moved to a new city. The city water with the chlorine in it was a problem for her. And there were certain spices that she used regularly that were problematic. And when we worked through that and she was able to remove those two, she went from having a migraine 5 to 7 days a week to 300, let's see, what was her? No, it was 189 migraine free days in a row, right? So basically she had one after 6 months, and it was immediately addressed with a triptan. And then she was able to, go another, I think it was 9 months without migraine. So, there can be some really drastic improvements. That's not by and large, like usually what happens. But it definitely can. There was another lady, she just had some cortisol issues. Nobody had ever looked at cortisol for her. As soon as we got her on some cortisol support, she literally stopped her migraines overnight, and she has not had one since. So, I mean, there are some of those things that we can figure out that can be immediate, but
wow.
Yeah.
Wow, this is all mind blowing. For a person that have never had a migraine, because I think it does takes a little bit to understand exactly how that happens, what's it feel, what are the symptoms. what are the triggers, like, are the people having one migraine a day to, have they have been having migraines for like a year or 20 years? So it's a lot of factors. And I think this is all great information for even people that have never had a migraine, because I think we could actually talk to my cousin now and be like, look, you might really take a look at all these things. Even though I don't understand what you're going through, I realize that there's a lot of factors that go within. Because, I did mention to her, like, well, it was just probably diet. But in reality, it's not just diet. It's a lot of different factors. And I love that you work as a team with the actual medicines, right? You don't tell them like, okay, you gotta stop doing this. You're gonna eat all organic and all those fruits and veggies, and that's it. So you actually are like mixing those two worlds of like, you might need this medicine, keep on taking it. How do you make sure that those things are being aligned or working together? Because you don't take the medicine away.
Yeah. So that depends on the person. There are some cases where, for example, someone's stuck in that triptan rebound. And then we have that conversation of, you know what, this isn't going to get better until we break this cycle. And so there are cases that, but the cool thing about naturopathic medicine is that it's not just a matter of having to go cold turkey and suffering for 72 hours before your body finally like processes through it. But we've got other tools that we can use to kind of help ease the side effects from that. It's still not going to be pleasant, but it's not going to be excruciating pain for 3 days, right? So we do have those tools that we can help them work through. But we're just, that's part of what I do, is just making sure, okay, is the medication that you're taking? I mean, there have been some cases where we've taken people off of birth control because that was something that I highly suspected was a problem for them. And initially that worsens their migraine, but then as we work on kind of clearing the body and supporting it in other ways, then the migraine goes back down to where it was pre, and then we start seeing that healing process happening. So that's for me, just kind of, that's where I've learned to kind of just assess. And it's not something that I can really share because there's a lot to it of figuring out that piece. But it is something I'm constantly aware of with my clients, knowing that they're all taking prescription medications. And then we always just have the conversation of when they feel ready, how we can go about weaning them off. And then we do that in conjunction with their prescribing doctor so that all people are involved and understand what's going on. So it's done safely and to the patient's best success. Like, for example, we don't want to start working off of an antidepressant in the fall, because usually winter is the worst time for depression because of storm systems, and we're inside all the time and we're not getting vitamin D and there's lack of fresh air. All of those factors have been correlated with depressive symptoms. So the optimal time for someone to come off a medication like that is not going to be in the fall. We want to wait till spring and then we start working off, right? So there's little tweaks and things that we can think about to set them up for the greatest success on coming off medications when they are ready to do that.
Yeah. I mean, I never thought about that.
Exactly. Yeah.
That's why you're the doctor. Yeah, it's great because little things like that. No, I mean, a lot of people are not thinking about that, but those are the little things that are gonna make or break things that you're trying to fix. So that's great. I have a question, because as I said, never had a migraine before. I don't know what that is. I even, not to brag or anything, but even like headaches, I'm headache free.
You are so lucky.
Not good. But, I mean, I do my work on it. Like I try to be good and exercise and sleep good and all that. But does all these migraines, do you get them too? Do you get clients that are kids?
So we don't usually work with children. Usually that's going to be more referred to a local doctor who's going to be able to work more closely, because the dietary stuff that might be involved. I mean, there's just a lot going on with a kid. And you really also, usually when we're talking about diet, because that's such a big thing for a lot of people, what we end up seeing is there starts to become a lot of fear around food. And then we start to see some eating disorder or disordered eating habits as a result, because there's a legit reason to fear food when you have a migraine, a problem with migraine, because so many things can trigger. And so then we start seeing malnutrition coming from lack of eating. There's also one of the symptoms is you just don't have an appetite. So a lot of our chronic migraineurs, it's not even when they have a migraine, they have no appetite. Usually they're vomiting during a migraine, right? So that's not obviously going to be beneficial for eating. And then when they're not having a migraine, they just have no appetite. And so we'll see somebody come in eating, 500 calories or less a day, and they're technically in starvation mode, which is not good for blood sugar. It's not good for nutrient repletion, and so then we have to kind of work through some of those emotional aspects that come through too, because trying to expand your diet when you're so limited and you have so much fear around it is a big problem. And so that's something that I always like to bring to people's attention as well. If this is something they've been dealing with for a while and they've, eliminated all their triggers, and now they're just eating a handful of foods, we have to be careful that you're not becoming malnourished as a result of such a restricted eating pattern too. And again, so we have to be careful and aware of that in children. And then plus on top of that, there's a lot of lifestyle stuff that needs to go on that a kid's not going to be able to do. And so our program is more geared towards adults, generally 30, 35 and over, because we do a lot with hormonal stuff that maybe is not also appropriate for younger women, or teenagers as well, because they're still trying to establish their cycle, and we don't want to be interfering with any of that as well. So I like to refer them to local practitioners for more direct, immediate care, and the exams that should be going along with care like that.
And I will think that, is there a lot of kids that suffer from this? Because I know like migraines, it stems from what I hear from you, what I read, that it might be some sort of like a chronic thing that is happening. So it happens more into the older individuals than the kids.
Yeah, there's probably about a 50-50 split in my clientele, of them remembering being 5, 6, 7-year-olds and having migraines and starting after puberty. So, definitely those of us who struggle with migraines, there's something in our body chemistry that predisposes us to that, right? Because there can be somebody who has horrible hormone imbalances, but they don't get migraines. We don't know why some people have these issues and it results in migraines for them, and somebody can have the same issues and not have any migraines. We don't really understand why. So, it's kind of, but what we do end up seeing is that as people who have migraines get older, then they start seeing them become more and more chronic, more intense. They start getting them more frequently. And then, we end up seeing that they're struggling with them, for 10 or 15 years, trying all these different treatments, trying all the different medications, trying everything they can figure out, and, still not seeing the improvement. And, part of that might come from the fact that as kids, we're able to bounce back pretty quickly. Our immune system works pretty well. Inflammation might spike, but then it goes away pretty quickly. I know, for example, my daughter had her first migraine. She's 5. She had it in March. And I know 100% what triggered it, but I didn't know that it would trigger it for her. And so the fact that she had to go to bed because she was in so much pain tells me I have to be really careful with her moving forward, because if I'm not, she's going to develop migraines as well. And so we'll be really paying attention to how her hormones are going as she's getting older, because that's probably going to be playing, and knowing that mom had them too, we know that she's at higher risk for that. So definitely we'll be paying attention to all of those things. And if somebody is a parent of a child that has these severe headaches, then there are things that can be done to kind of help to positively influence. And so we really need to work on in little kids, diet food is the best medicine. If we can get them away from sugary treats and away from, all the kid colored dyed cereals and things like that. What triggered my girl was we were camping. And so I couldn't find any of the organic, marshmallows and things that I typically do. So we had regular, honey graham crackers and I know. And the jet puffed marshmallow cream. That's all I could find. And that's what triggered her, right? It was the combination of the gluten and the chemicals in that marshmallows that did it for her. So, so if we're aware of some of the chemicals and things that our kids are being exposed to, and we kind of work on teaching them proper eating habits early on, we can actually stop some of these processes because their nutrients aren't going to be drained processing out those chemicals. And then those nutrients can be used to just keep their bodies moving happily. Okay. Plus, the more fruits and vegetables and whole foods they eat, the more nutrients they're going to be intaking from their food. And so we can actually have a very positive impact with kids with just food alone if we're really paying attention to it and we're training them to make healthy choices for themselves and their body.
That's awesome. And that's just like a great tip just in general.
Just even in general, it sure
even
is.
If your kid doesn't have migraines,
that's
please,
right.
The better you fit your kids, that you're setting them up for like a more successful life in everything, how they act in school, how they learn, how, just everything, behavior, everything. So yeah, so that's great for everyone out there. Parents, please pay attention. And then my next question was, do you think it makes a difference if we treat migraines like as, the soonest, or it doesn't matter when you treat them? So like, let's say I just had a migraine yesterday. Should I go to the doctor or to a functional doctor like right away before I get the next one? Or does that make any difference than if I just wait like 5 years?
Certainly, the sooner you can be diagnosed and start seeking treatment for it, the better off, the better the outcome, the faster the improvement can occur. So yeah, if it's something where you've been having these massive headaches and you've never really gone in because headaches are headaches, they're just really bad for you. But now you're starting to think, well, maybe I do have something. It would be good to go in and talk to your doctor and kind of point out some of these migraine symptoms that you're having to get the proper diagnosis so that you get the proper support. Then there's also can be some potential long-term issues that we're looking at with various different aspects of migraines. There can be increased risk for strokes and some other things that can happen based on the type of migraine you have. So knowing all of those things and making sure that the prevention is there is absolutely the best bet. But it's never too late. Right. So, if you feel like there's something and you've never talked to your doctor, it's worth just mentioning it. They might say, oh, sure, it's just a headache, take your Advil and whatever. And if that takes care of it, then fine. It's probably just a pretty bad headache. But, if you're like, I have, and it usually doesn't work, then they need to be doing a little bit bigger, or, a little bit more digging for you.
Yeah. And we'll just say that because I know a lot of our doctors, and that's, I love all the doctors, but some of them are modern medicine. When you go to the doctor, they're like, you're fine. You're fine. Just go by your day. You're fine. But deep inside, we always know like, well, I have all these headaches and they're not really going away. They're getting worse. And the doctor tells you you're fine. Is that maybe like at that point you want to like look for like more of a alternative help just to be on the clear? Because a lot of doctors, myself, I had a bad pain on by the gallbladder and they automatically wanted to take it out.
Yeah.
And I'm like, no.
Yeah. Well, if you think about the way that we're trained as physicians, we need to take a look at the physical exam. We need to take a look at the labs and, any imaging or whatever else that we have available for us, if that's appropriate to order. And if everything comes back in that standard range, normal range, there's nothing abnormal, then part of the battle with that diagnosis being told you're fine versus not fine is all your labs look good. Your physical exam is good. I understand that you are having these symptoms, but there's nothing that we're finding. Insurance is going to cover anything else. So then the job of the doctor is to try to keep that unnecessary spending down and reassure the patient they're not dying of anything, right? They've been checked out. Everything looks good. But then the frustration on the patient part is everything looks good, but I don't feel good. I know there's something going on. And so, but then the barrier to that is when you go into a functional or ND doctor or a functional medicine doctor or an ND, we often operate outside of what insurance covers. So then there's that money barrier. So it's really kind of, you're stuck between that rock and the hard place. And when we're looking at, there are a lot of doctors out there that they'll order the tests, but they're trained. And in some cases they're told, you don't order these tests if they have to pay out of pocket. That's part of, what they're told as their employer. Right. And so their hands are tied. And in a lot of cases, they're super frustrated too. So, anyway, I get the frustration on both sides because I've been on both sides and I see it from both sides. So if you feel that the conventional approach, you're just not able to get anywhere, the doctor isn't able to or willing to order any more diagnostic because of whatever restrictions they might be working under, then that would be a good time to go into the functional medicine doctor or the ND, but understanding that a lot of the lab testing and the other stuff that they might be doing might not be covered by insurance. And so that's always something that most NDs are really good at explaining. Here are the fees. This is the test, the cost of these labs. This is what we're looking at, and then kind of working together. What do they need versus what would be nice to have versus what you can afford, and then kind of moving together on that. So very much the financial piece is a consideration from both sides, from the ND and from the conventional medicine side. And it can be super frustrating for all parties.
That's like probably like the main thing that sucks, when it comes to trying to figure out things and just in general, like, one side is not giving you any answers, and the other side, you're like, want to get better, but then financially I might not be able to afford it. And that's another dream of mine, that maybe like insurance can cover all practitioners, because they're all doing their job. Like patients are not just going to the chiropractor or to the acupuncturist or functional medicine just because they want to have a day with the doctor.
Right. That's right. Nobody likes going to those.
It just makes no sense. Like if people are going to all these alternative doctors, it's because there's something happening and they just want to have some relief of some sort. I was going to say, is there in any of those situations, do you specifically, because I'm talking to you, but do you work with primary physicians? Maybe like you could tell the patients, because I know some of them do that they tell you need to get these labs done. Maybe your primary physician might be able to order them, so they're like within the insurance, and then they'll come back to you to maybe to do some of that teamwork and have less of an expense when it comes down to the financial stuff.
Yeah. So when I was in primary care, I'm in Washington State. And so I worked at a clinic for the first 10 years of my career. And we acted as a primary care doctor. So we were covered by insurance. The labs and things that we ordered were covered by insurance, unless it was one of those functional labs. And then in that case, sometimes it was cash pay, but sometimes insurance would cover it depending on how it was coded. So, there's all these little things that can be done currently now. So depending on where you are in the US, some insurance carriers will cover NDs, will cover functional medicine doctors, will cover labs to a certain extent. And so you can kind of get the best of both worlds through there. And then there are other states or other insurance companies where that's not the case, and you have to pay 100% out of pocket. So it totally depends on the area that you live in. Currently now, I'm no longer working in a clinic. I'm strictly online. I have my Migraine Mastery program that because I'm working with clients across the country, and I'm not licensed in every single state, I'm just licensed in the state of Washington, then I cannot act in a physician capacity for them. So I cannot order those types of labs. So I do send them back to their doctor to kind of work as kind of that go-between, and insurance does cover it. Mostly what I ask for is going to be, typical labs that would be ordered through a yearly exam anyway. So I'm not asking for anything weird. And then usually there's no problem in getting most of those things ordered. And then insurance covers it as part of the yearly exam. So there are ways that you can kind of navigate through some of those if your doctor is willing to be that go-between, because then there's also the professional courtesy of one doctor doesn't tell another doctor what to do, right? So they have to be willing to say, okay, sure, I'll help out, as opposed to, I don't know why you're ordering those labs, so I'm not going to order them, and which is understandable. The doctor ordering them is responsible for justification. So if they don't understand what we're doing, then they're not going to be comfortable ordering them, right? So yeah,
one of those.
Yes, that's right. The professional courtesy things that also need to tread lightly on, that, not all patients are aware of that fact either. And they're like, well, just order the test. But they do have restrictions they have to work into. So
yeah, for sure. And just like have the patience and understanding a little bit when you want your functional doctor and your primary doctor to kind of like work together. I think, being in both sides is usually kind of like the best way to play this out. Explain, I guess, both of your physicians what you want, what you're going through, why they're ordering these tests. I think that'll be helpful, especially because, a lot of us probably don't have all these extra money to be like, oh yeah, do all these tests, because they're so expensive. I mean, I had a test last year. I don't even remember what it was. And the doctor ordered it. And then months later, I got a bill from the insurance stating that, oh, this test is not covered by the insurance. By the way, you owe whoever $250. I was like, I didn't even want the test.
Yeah.
I mean, crazy.
That's just it. The test that we do with our clients, we do a neurotransmitter panel, an adrenal panel, and a full hormone panel. That test that we order is $700. So, I mean, so it's crazy. Some of but they're also very involved tests, right? So it's not necessarily that it's inappropriately, whatever, but we're just not used to spending that. And by the way, our client, like, that's part of the package that we offer. We don't have them pay that separately. That's what part of what we do is our evaluation. But I mean, they certainly can add up. And then a lot of those tests, especially with hormones, you're looking at $250 to $300 a pop. And you usually get them every 3 months for the first year or so as you're really working on stuff. So it can add up pretty quickly. And again, those are some of the tests that insurance will and will not cover. So you really need to make sure you're doing your footwork beforehand, give them the codes, give them the test information, and then they will tell you up front whether or not it's covered. So that way, what you're going to be responsible for or not. So you don't get any of those unpleasant surprises of the tests, bills later down the line.
Yeah, for sure. And I mean, when it comes down to our health, I always say your body, yourself is the best investment. So even if the insurance doesn't want to cover or whatever, and you're having these crazy migraines or whatever it is that you're having, and you need to go to a functional doctor, I think it is worth it to pay, $200-$300 sometimes for a test, than live your life in pain and not knowing what's really happening, than just pay what it is, and then you'll find out how to get better. So I think that's worth it, at least for me. And I know money is tight, and with COVID and all that, things are hard. But I think when it comes to your body, canceling Netflix for 2 or 3 months is worth it. Canceling certain things that are not serving you, as well as to, get your body going. I think it's worth it. So those are some of the things that people that have these type of things going, need to think about, and priorities and all that. And remember, it's not forever. You don't have to be doing all this testing forever. You don't have to be going to the doctor forever. Once you know what's wrong, then you can find some sort of solution with your team of doctors, whoever is helping you out. And then on the long run, you're going to be saving money.
Yeah.
And that's kind of like how I see it. And,
well, and that's a great point, because there was a study that was done just a few years ago on specifically for migraineurs. And on average, they spent, between copays and doctor visits and medications and all this other stuff, they spent $7,000 a year more on their health than somebody without migraine. So, I mean, but it's all like all these little expenses through the year that you don't really add it up to see, oh my goodness, like this is crazy. So if you do put some of that investment up front and, really work on clearing that, then the rest of your life, you don't have those bills anymore. Like you've ultimately saved, $50,000, $60,000 on care over the next 10, 20 years. So, but it's hard to think of it that way, right? We're so used to insurance kind of covering things. And with the way that, that functional medicine is now starting to kind of really take hold of, a lot of people are really interested in looking at things from this perspective. Now we're starting to see, oh my gosh, it's how much? It's not my $20 copay, it's $300. And it's just a shock to think of. But, you're right. If we can get to the bottom for you and you start feeling better within 6 to 12 months, then you don't have to worry about any of those copays or medications anymore. And you start coming out ahead. But it is definitely a different way of thinking about it. And who wants to invest in their health when they can go do something fun, assuming they can still. I mean, some of my poor migraine clients, like they can't go do anything fun anymore anyway. So anyway.
Yeah, no, for sure. And I know, some of those migraine patients, as I said, I use my cousins because I've seen them, both of them, for years, just with this bad headaches and migraines, and they can function and they can go to work. So now you need to think about, like, you can go to work, so you're losing a whole day, or you're using your PTO or whatever on this, so you are wasting money on something that's not even like serving you in any way. And also too, as you mentioned, it's not just the copays and the medicine and all that, but it's also the, I've seen them, like, when they can't handle the pain, where did they go? ER, emergency room, whatever it is. Now you have to pay for that too. And it's not cheap. So yeah, definitely thinking about all that, I think, is super essential for your healing itself.
Yeah.
And yourself.
I get that too, because I remember back way when I started my whole process, organic, are you kidding me? I'm going to pay twice as much for my vegetables. I don't think so. And now I won't even look at the conventionally grown. It's like, I know how I feel now, and it is so worth it to me. But that's not where I started from. I did not start where, eating this whole food and having to invest the time and the money, and I'm paying more so that I have to do more work to actually eat the food. I'm like, this doesn't make any sense to me.
Yeah, exactly.
But now, being on the other side of it, it's like the time investment, the money, the financial investment. I can live my life instead of, going to class and coming home and sleeping for the next 10 hours. I'm actually able to go boating with my family and run around with my 5 and 7-year-old outside in the hot sun in the middle of July and be tired, but fine. I mean, just the trade-off to me is 1,000 times. I'd spend 100 times more than I'm spending on it now, because it's just, as I get older, I realize how important my health really is to me. Whereas when you're younger, it's important because you want to go do stuff, but it's not like a priority. As you get older, health and how you feel and like your pains, that starts to become a priority. And you really see, okay, this is worth putting a little bit of effort and money into my health now, as before, whereas when you're younger, it's not quite so worth it.
Yep, for sure. Well, thank you for all this information. I know we talk about a little bit of everything, and I hope everybody learned something. I know I did. Migraine, it's a big topic, and there's a lot of things that we still don't know about it and why it happens and all that. But I think all the information that you gave us today was super important. I'm sure everybody knows someone that has migraine and can be like, hey, it might be this or that. You gotta go check it out. Before we go, is there something else that you would like to share with us?
No, I think we kind of covered quite a bit. And I don't want to overwhelm people, but I think the biggest thing that I would just leave everybody with is just knowing that if you have been struggling with this for a while, there are alternative ways to approach a migraine treatment, to actually individualize it to you and understanding what's going on in your body and what it needs to feel better and to actually heal. And I hear all the time, like, this is just my life. This is what I've been given, and you don't have to accept it. Like, that's what I thought. And then I went to med school and learned what I've learned now. And I realized, from where I was, I never would have imagined that I would feel better in my 40s than I ever did in my 20s. And it's only getting better as I continue to heal my body and do things for it. So I just want to put that message of hope out, because there is hope. And I know that how hopeless that it can feel when you feel like you're fighting this battle alone, and you don't have to. So.
Yeah, for sure. And if anyone wants to get in contact with you, or, have some questions or whatever, where can they find you?
So the best way is probably through my website, or I'm also on YouTube at Migraine Mastery and Migraine Free Life, and on Facebook under Migraine Mastery.
Awesome. And I will be putting all her information in the show notes so you guys can find her easily. If you guys need to find me, you guys know you can go on Facebook, Instagram, YouTube, Alex Falgood, and alexfalgood.com if you want to check out my website. Also, my book is out, so you can find it on Amazon and Barnes & Noble. It's called Parents Are Greatest Teachers. So if you haven't got a copy, go get it. Leave me a review. Send me a DM me. Yes. And if you need anything else, just send me a message. Thank you, everyone, for listening today. Thank you for being here today. It was an awesome conversation. Have a blessed day, everyone.